The slide deck, okay. Welcome to the 2026 CCHQ Pre-Retirement Seminar, Transitioning into Retirement in the United States Public Health Service Process. Again, this session is going to be co-presented by Commander Alexander Amakwa, Chief of the Separations and Assignments Branch, and myself, Lieutenant Commander Jernice Dixon, Team Lead and Separations Counselor. Today's agenda includes reviewing the timeline for VA disability claims versus PHS submissions, walking through the U.S. PHS retirement process, including required forms, discussing communications from our team and what happens after your retirement package is submitted, covering retirement activities such as travel and lump sum leave, and highlighting available resources on CCLMS and CCMIS. We will not have time for a Q&A today, so we have included slides with frequently asked questions at the end of this slide deck for your reference. We are going to start with the retirement preparation timeline. Officers who plan to file for disability benefits can submit their claim before separation through the Veteran Affairs Benefits Delivery at Discharge program, also known as the VA BDD program. A few key requirements to note for this program. This program is time sensitive, so claims must be filed 180 to 90 days before your separation date, which is approximately 6 to 3 months out. This window gives the VA time to review your service treatment records, schedule exams, and process your claim before separation. Please note that filing before your retirement date is optional. You can also file after separation if needed through the standard VA claims process. Some key steps on the timeline on the slide. 1 to 2 years before separation, you want to obtain a copy of your official medical records and create an eBenefits account at www.ebenefits.va.gov. 12 months out, a PHS exit physical is highly recommended, although it is not mandatory. In accordance with Commission Corps Instruction 221.02, the Corps advises officers to complete a comprehensive retirement or separation exam before leaving active duty, since this is often the final opportunity to document any medical conditions that may be service-connected. If an officer has completed a periodic health update or the PHU within the most recent scheduled PHU cycle, then that PHU may be used in place of the PHS exit physical. A VA disability claim may be initiated either before or after retiring, regardless of whether a PHS exit physical was completed. Also, at 12 months out, you should identify a veteran service officer, or also known as a VSO, to assist you with your claim. 6 to 4 months out, you are going to submit your claim and upload your application and service treatment records online. At least 45 days from the date of the claim, of when the claim is submitted, you should be prepared to attend VA appointments and exams. And at least 4 months before separation, you want to make sure that you confirm with your agency liaison that your retirement package was submitted to our separations team at CCHQ. This timeline includes both the VA BDD program steps from the previous slide and the PHS retirement steps. I will concentrate on the PHS steps for this slide. This PHS retirement timeline is a guideline. Start planning early. Retirement preparation takes time. Except for the VA BDD claim, most of these tasks can be completed ahead of the scheduled month markers listed on the slide. 2 to 5 years before retirement, you want to gather your medical records and ensure that they are complete. For prior service members, you want to make sure that you review your EOPF to ensure your reserve point sheet is included. If it is missing, you will need to submit a request to the National Archives. You also want to start thinking about financial planning and your retirement goals. 18 to 12 months out, you should complete the DoD Transition Assistance Program, also known as the TAP course, to learn about VA programs and benefits that are available to you. You are also going to schedule your PHS exit physical during this time frame. 12 months out, you're going to want to make sure that you work with your agency liaison to begin the PHS retirement process and complete the required forms that I will review later in the presentation. You are also going to take the PHS retirement course on CCLMS. This course does render a certificate of completion. And 6 to 4 months out, again, you just want to make sure that you confirm with your agency liaison that your retirement package was submitted to our team at least 120 days from your last day at your duty station and not the effective date of your termination. There are several retirement types that I'm going to cover. Mandatory is a required retirement, not optional. Officers must retire after 30 years of active duty service across all uniformed services. They also need 10 years of active duty service in PHS. Extensions beyond 30 years can happen, but only under special circumstances. It must be approved by the Surgeon General after a board review. Voluntary retirement is a personal choice. It is not mandatory. Officers can request retirement after a minimum of 20 years of active duty service across all uniform services and at least 10 years of active duty service in PHS. For age 64 retirement, an officer may retire on the first day of any month after turning 64. This retirement requires at least 12 years of active duty service with at least 10 years of active duty service in PHS. Disability retirement is available if the condition occurred on active duty and was not due to misconduct. A temporary disability is reviewed annually by the Medical Affairs Branch and may be converted to a permanent disability at the discretion of the Medical Review Board. Officers may be on a temporary disability for a maximum of 3 years. And last, a permanent disability is a final decision. There is no annual review. So in terms of the retirement effective date, the retirement effective date is always the first day of the month after your eligibility date. So using the example timeline on the slide, if your retirement credit date is August 23rd and you plan to end your active duty on August 31st, your effective retirement date would be September 1. Officers will start the retirement submission process with their agency liaison. The liaison, there are several processes that the liaison will complete on your behalf. The liaison will confirm that you have completed or that you are enrolled in the retirement course on CCLMS. They will ensure that your retirement package includes all of the required forms, and they will submit your complete retirement package to our separations team at CCHQ on your behalf. Just a policy reminder, agency liaisons must submit packages to CCHQ within 120 days of your last day at duty station, not your effective retirement date. Some agencies may also need additional time for internal processing before submission. So just please confirm with your liaison how much extra time your agency requires. So this visual lists the required documents for each retirement type. Required for all retirement types includes forms PHS 1373 and the DD 2656 and completion of the retirement course on CCLMS. Key differences to note: voluntary and age 64 retirements require a retirement memo, and the disability retirement does not require a copy of approved leave. All required retirement forms are available on CCLMS under the Assignments tab. On the next few slides, I will walk you through where to locate these forms. So this slide shows a screenshot of the Assignments tab on CCLMS. So to access the retirement forms, you are going to scroll down and click the link that's labeled Submitting Separation Forms. Both of these are circled in red for the links that you will click on once you're on the CCMIS website. After clicking the Submitting Separations Forms links, you'll see a page listing all required forms. Key forms include the PHS 1373, the DD 2656, and you just want to make sure that with this form that you are using the version that is dated March of 2022. You will also need to complete the exit physical medical exam. Again, this is optional, so it's at your discretion. And then the HOMA selection form is required only if a selection was not made on the PHS 1373 when you submitted your retirement package. If it was not selected at that time, then this form must be submitted within 3 years of your retirement date. So next, I'm going to walk you through just some key items to note on the PHS 1373, which is the separation of commissioned officer form. As the officer, you will fill out Part A on this form. Just a few questions to note. For question number 7, your last day at your duty station. This is the last day performing work at your duty station, which is different from the termination effective date if you are taking terminal leave after the last day, after your last day going into work. Question number 8, terminal leave is any annual leave after your last day at your duty station. It does not have to be consecutive, and it should match what is in ECOR at the time when your retirement package is submitted. For question number 7, the home of selection, this is the location retirees choose for travel and household goods shipment after retirement. It offers more flexibility than the home of record or place of entry on active duty. It allows retirees to select any location within the United States. And last on this form, on this page rather, question number 17, permanent contact information. Please make sure that you provide current contact information. The separations team will use this information to contact you as needed. And then also we will use the mailing address provided to mail your retirement certificate, your spouse certificate of appreciation, as well as the DD 214 form. Part B and C on the PHS 1373 will be completed by your agency. The next required form is going to be form DD 2656. This is the data for payment of retired personnel. This form must be submitted in order to start receiving retirement pay. It becomes effective at midnight on your retirement date. A few important details about this form. You just want to make sure that after your name, you include your DA, employee ID number. On this page, you also want to make sure that you provide your social security number. You want to select USPHS as your branch and enter your preferred direct deposit details or attach a voided check. As stated earlier, you want to make sure that you're using the latest version of this form, which is dated March of 2022 at the bottom of the form. Also on this form is the survivor benefit plan. This provides an annuity to your beneficiary after your death. Your beneficiary will receive 55% of your retired pay as a monthly benefit. The cost of this benefit is 6.5% of your base pay, which will be deducted from each retirement check. Enrollment in SBP is automatic, so please make sure that you take action to decline if you do not want this coverage. Also important to note, once you decline SBP, the decision is permanent. If you are married and you choose not to enroll, or if you select reduced coverage, your decision must be notarized. There are two key signature requirements on this form. Part 4, the certification, it must be signed by the officer and a witness. The witness cannot be the spouse or a beneficiary, and the witness must sign after the officer on the same date. This form can be signed electronically using a CAC or a VPN. Also, Part 5, the spouse SVB concurrence, is required if the officer is married and elects child-only SBP coverage, less than full spouse SBP coverage, or declines SBP coverage. In this section, the spouse's signature must be dated no earlier than the officer's signature. And if a notary is required, then the original hard copy of this form must be mailed to CCHQ. I know that was a lot of information about signatures, but this information is also listed in the direction box on the form. So just make sure that you read carefully over the directions for both part 4 and 5. So what happens after you submit your retirement package? Once you submit your retirement package, your agency liaison, once you submit your retirement package to your agency liaison, the separations team will send you an email acknowledging receipt. We will review your documents to ensure they are complete, accurate, and meet eligibility requirements. After the review, if everything is in order, you will receive a confirmation email with your effective retirement date and next steps. If additional information is needed, we will contact you promptly to resolve any issues. And on the screen, this is just an example of what your confirmation email will look like. And then here's a glimpse of our review process. So once we receive a retirement package, we create a file for the officer and organize the documents into separate folders to perform an audit to verify retirement credit date, your retirement plan, and also any prior service if applicable. If prior service is applicable, we will also copy the documents listed on the screen from the officer's EOPF to verify prior service. So now we're just going to briefly discuss computation of retirement pay. So I just want to do another quick check. If you could drop in the chat which retirement plan applies to you, final pay, high 3, or BRS. Your date of entry into the military system or your deems date determines your retirement plan. Each retirement plan uses its own multipliers and payout structure. The retirement benefit is calculated based on your base pay and a percentage multiplier that reflects your years of service. So for example, if your retirement pay service multiplier at 20 years of service for high 3 or high 36 would be 50%. I know it's a little small on the screen, but on the sheet that's on your screen, if you look at 20 years of service, you will see that the multiplier is 50%. So to calculate your retirement pay, so you are going to average the highest 36 months of your base pay multiplied by the service multiplier percentage. So continuing with the example on the previous slide, for high 3 or high 36 is 50% at 20 years. So you would take the average of the highest 36 months of your basic pay and multiply that by 50% to calculate your gross retired pay. In terms of retirement and taxes, for federal taxes, your pension is subject to federal taxation. When completing the DD Form 2656, it is important to make sure that you elect to have some federal taxes withheld. This can be adjusted later through direct pay or the Pay and Personnel Center, PCC, if needed. State income taxes are generally paid to the state where you physically reside. If you are a partial year resident in multiple states, then you may owe taxes in more than one state. Just make sure that you check your state's rules regarding residency and military pension taxation. One good thing to note is that the VA disability compensation is not taxable. And then military retiree pay is managed by the United States Coast Guard. So for more information about that, you can visit the website that is listed on the slide. So now I'm going to hand the presentation over to Commander Amakwa, who will cover the DD 214, travel and household goods, and then conclude the presentation.
In 2016, the DoD signed a memo that authorized the U.S. Preachers Commission Corps to issue DD 214 for officers who separate or retire from the service. So we are going to talk briefly about the DD 214 this morning. So this form is a form that we use when either you separate or you retire from the service. Before, we were issued PHS form 1867, that is the statement of service form. That form wasn't widely acceptable, but now with this new form, PHS officers are able to go anywhere and then they will show that they were part of the service. So I'm glad that we're able to be issued DD 214. So in the course of your retirement, we'll go over details about how to complete this form, but this is going to be just a brief overview about how we go through the process. So the form is used by various agencies such as the VA to verify your active duty military service. And this evaluates our ability for veterans benefits and apply for veteran IDs. Most states, they issue veteran IDs. I believe Virginia has that option. If you can present your DD 214, they'll be able to issue a veteran's ID. You can also use your D214 to be able to assess your skills with the DOL or the Labor Department. Officially, this form was issued to officers who retired on October 1, 2021. That was when we started the live issuance of the form for active duty officers. Recently, we are able to issue the form to officers who retired or separated from 2016 all the way to 2021. The reason is because the memo was signed in 2016, so we received authorization to be able to go back and issue the form to officers who either separated or retired from 2016 to 2021. So when you are ready to retire, you are going to be we will initiate your D214. When you get that notification, it's going to be a system-generated email, and then that will follow up with an email from the separations team. So the system-generated email usually will not give you the right link. So when you see the first link, do not worry about the link being incorrect. That is the way the system was developed. But the form is actually in CCMIS, the forms platform. So that next instruction will tell you where to go to access the form. So once we're able to process your D214, it will be part of your retirement package. Your retirement package is going to include the final signed D214, the US flag, and the retirement certificate of appreciation. That is going to be the retirement package. And that is going to be mailed to your physical address. The package is not supposed to be mailed to the PO box. So make sure that when you are completing your PHS form 1373, you make sure that we have your physical address. That is where we are going to mail your package. If there is a change in your mailing address, make sure that you indicate on the form. Because sometimes we get these packages back because it went to the wrong address. So make sure that if you are moving after retirement, make sure that you provide the new address that you are going to be residing. And in some cases, if there is an amendment or if you receive like a career rep award, our team will be able to amend the form for you. Or if there is something that was wrong on the form at the time that you receive it, you can contact us and we will amend your form for you. But most of the things that we use to amend are probably your career rep awards, because that sometimes you get it after you retire. So this is what we were discussing before. You will receive the first notification, and then the second one will be instruction how to complete it. It tells you the step by step. So with this form, you'll be able to access only a few sections of the form when you log into CCMIS. So you complete those sections, and then it will ask you to submit the form to the team to process. It's just like when you are completing your COA. It's on the same platform. So you complete your part, and then you submit to the next section, which is going to be the separations counselor. Once we complete the rest of the form, it's going to be, the final form is going to be in your EOPF under the separation section. So when the form is completed, the draft is going to be in your EOPF under the separation section for you to review. Once you review and everything is correct, then we are going to finalize the form. So make sure that you complete the form ahead of time before you go on terminal leave. That is one thing that is very important, because this form is accessed through your PAVE on CCMIS officer secure area, you need access to the officer secure area to complete the form. So if you know that you are pending terminal leave, make sure that you inform the separations team. What we are going to do is we can initiate your form ahead of time so that you can be able to complete the form before you go on terminal leave. Because once you go on terminal leave and you don't have access to your laptop or your PIV, you cannot access the form. So this is the final product of the D214. Once it is completed, you'll see 5 different pages. Do not panic about that. Each page serves a purpose. The first page is the member page. As you can see, the difference between the member page and the service page is the member page has up to section or block 24. The service page has all the way to block 31. So the service page is what I would say you need for your career, because it contains your type of separation and the character of service. Because if you are going to apply for any job after retirement or separation, you are going to need the service page, because that tells the employer about the character of service. And that is the form that you are going to need if you want to apply for any VA benefits. You have the option to use the third page, which has the VA on it. So if you want to apply for VA benefits, then you have the option to use page 2 of 5 or page 3 of 5. So my preference for you is to use the Veterans Administration's copy, because that is the one that they are going to put in their record. If you want to put a copy with the DOL or the Department of Labor, you are going to give them page 4 or 5. Remember, CCHQ do not send copies to these agencies. So you are supposed to make sure that you send these copies if you want to file for the VA claim, or if you want a copy with the DOL. And the last page is the remarks page. In case you have several awards that is not going to fit block 14, we can use the remarks page to add your additional awards. The same thing goes to your education. If you have more education or courses that is not going to fit block 15, that will go to page 5 of 5. So now that we have discussed D214, we are going to talk briefly about travel and household goods, which is usually under the Administrative Services branch. So they handle the travel after retirement, but we are going to talk briefly and give you the main information that you need for your retirement. So for your post-retirement travel, that is determined by the Joint Travel Regulation, or JTR. So now officers have up to 3 years to select their home of selection. So what does this mean? It means that when you are ready to retire, you have 3 options. Your household goods can be shipped to either the place where you entered active duty or your plead, or the second option is your home of record. The third option is the home of selection. So the home of selection can be anywhere within the US. So if you decide to ship your household goods to maybe Washington or Seattle, Washington, even though it's not your home of record or your plead, upon retirement, you can select Seattle, Washington for the government to ship your household goods for you. With that said, you have 3 years from the effective date of your retirement to make that selection. So during the time of your retirement, you can decide not to make any selection until you are certain that you want to move to that location. So that is the 3-year option. However, the non-term storage remains 1 year. So once you retire, the government is going to pay for you to store your household goods up to 1 year. After 1 year, you can still keep your storage, but that is going to be on your own dime. So remember, home of selection is up to 3 years. Non-term storage is only 1 year. And for more questions about your travel, please contact PHS Travel at hhs.gov. And if you are retired and you want to request extensions, that is also the email address to use.
Mander, real quick question. There were a lot of marks on your presentation, green check marks and red lines. I don't know if that's you with your mouse. It's not something we appear to be able to clear.
I don't think it's on our end. I noticed there were some names that were popping up on the screen, and after those names were popping up, I noticed that some marks were being made. So I don't
Okay.
know.
Okay, all right. Thank you. Yeah, we've tried to tweak the settings from our end, but we're not able to.
Yeah, that's
Okay.
kind of strange because I see
Yes.
the red and the,
Well,
yeah.
yes, and we'll share the slides afterwards with all participants that don't have the markings on them. So, all right, please proceed. Thank you.
Yeah. Yeah. So we are going to talk about what causes delays in processing orders. The first reason is late submission. Even though we have the 120 day for your last day at duty station, sometimes we get last minute submission of price service documents. These are very important to be able to adjust your multiplier. So I will advise that if you have any prior reserve time or prior military time, start reviewing your EOPF to make sure that every document that you have is on file. Because before we start your retirement, we go into your EOPF to pull all your prior service documents. So please make sure that you review your prior service documents, especially if you are in the reserve. Make sure that your retirement point sheets is in your EOPF, because that is what we are going to use to give you an additional credit towards your multiplier. And like I said, price service, sometimes we use it to recalculate your retirement credit date, but we should be caught up based on the price service project that we did 2 years ago. So I will also encourage you to continue. Good morning again. We are so sorry for the technical difficulties. We promise that when we go to Ohio, it's not going to happen when we are live in person. So let's continue with where we left off. Another thing that causes delay is going to be the late submission of the DD 2656, or when there are errors on that form. As you know, this is one of the most important forms that you need to submit before your retirement. Without this form, you are not going to get paid. This is the form that the Coast Guard uses for your pension. And if there are errors, the Coast Guard is not going to accept the form, so that will cause a delay. And another thing that we are working to resolve is the workload, which although there are staffing shortage, we are still trying to make sure that officers are getting their retirement orders at least 2 to 4 weeks in advance before they retire. So now the final countdown. So these are the things that you need to do when you retire. You have to make sure that you are enrolled with the FED for your dental and the vision. Make sure that you attend our transition sections, which are done 2 weeks before you retire. Like I said, we work with you to complete your DD 214 during these sections. Around the same time, once you have orders, make sure that you schedule an appointment with your shippers, work on your terminal leave, and then you make sure that you have your medical records. And also, most importantly, you make an appointment to get your retirement ID card. If you need to transfer your GI Bill to your dependents, make sure you do it before you retire. Make sure that you transfer your GI Bill before you retire, because once you retire, it will be difficult for you to do that. So make sure that you do that. And before you do that, make sure that your dependents are all up to date in DS. And then if you have any final awards, make sure that you submit ahead of time so that it can be updated on your DD 214. So these are the resources that you need to know. TRICARE, DD 214, ECOR for your lump sum leave. For your lump sum leave, you make sure that it is audited before you retire, and then also be patient with that because it takes up to 90 days for that to be processed. So if you haven't received your lump sum leave the month after retirement, please be patient because PCMB, they audit your leave to make sure that they are checking if you were prior service and you were paid before. Because remember, your lifetime payment is 60 days. So if you are prior service and you were paid before, they make sure that they do the audit before they make the payment. So 90 days is usually the time that it takes for you to get your lump sum leave. TSP, make sure that you transfer your TSP before you retire so that your account will be up to date. And TRICARE, these are all the benefits that you are going to, I'm sure there will be presentation on TRICARE and benefits. But for now, that concludes our presentation. Again, we apologize for the technical difficulties. We hope that we'll see you all in person in May. That's all we have.
Thanks, Commander. This is Annette Beadle. So I don't know if Commander Dixon or do you guys want to, I know we're right on time and the next speaker is already dialed in, ready to go, but is there any, do you want to take like 10 minutes to maybe address some of the FAQs that you have at the end of your presentation? If there's anything that consistently pops up that you've dealt with in your positions that you might want to get ahead of that and just address them now?
Sure. Let's see. So to make up for the difficulties, now we are trying to see if we can cover some FAQs. So the first one is about retention bonus. So can an officer retire when they are under a multi-year retention bonus? The answer is no. If you are requesting a voluntary retirement, the policy does not allow you to retire if you are under a retention bonus. However, it does not apply to involuntary retirement, which can be medical disability retirement or involuntary retirement. If you go to the board and you are made to retire, that is not going to apply. But if you are doing voluntary retirement, then you cannot retire. if you are currently in the middle of a multi-year retention bonus contract. Again, it's the same. Even though you want to pay back the amount that you have been paid, because you are currently under contract, the policy does not allow you to retire voluntarily if you are under contract, except if you are going to retire involuntarily, like medical, if you go through the MAB process and you are deemed to retire either permanent or temporary under the PDRL or the TDRL, then you can retire. So if you are planning to retire and you know that you have the option to do either 3 years or 4 years, then if you know that you only have 3 years left on your mind to retire, then I would say work with your agency liaison to choose the 3-year option versus the 4-year option. That will give you the time to complete your obligation before you submit your retirement package. So this is about the 3-year option for the home of selection. Yes, JTR now allows retirees up to 3 years from the effective date of their retirement to select a place for their home of selection. The HHG storage, like I said, is still 1 year. After 1 year, you are going to bear the cost if you still want to keep your household goods in storage. So what most officers do is they make sure that they align the 1 year with their selection so that they don't have to pay extra. Another question is, what if I want to move my household goods to Mexico? We had someone who wanted to move to, I think, Morocco or I think Libya. So what we do is, even though you cannot select Mexico as your home of selection, you can still move your household goods to Mexico. However, the government is only allowed to take you to the farthest points, CONUS. So if Seattle, Washington is the farthest point on the West Coast, we are going to take you all the way to Seattle, Washington. And then if there is additional cost, then the officer is going to pay the remaining cost. Sometimes it could be the same, or sometimes it could not, depending on the mode of travel. But we are not going to authorize you to move your household good directly to the state outside of the U.S. territory. So this is per the PHS 1373 policy. Once an officer submits a retirement package, they cannot change anything on the form. The only time that you can change is when there is an emergency or the agency submits a request to CCHQ to change the form. That will go through a formal review process. So the agency liaison or the agency will have to justify the reason why they want to keep the officer longer than the dates on the form. The only time that is going to be without the director's approval is if there's like sick leave or if the officer has a medical emergency, then we will allow the officer to stay a little bit on active duty before they can retire. Can officers direct their lump sum leave payment to be part of the TSP contribution? The answer is no. Lump sum leave payment is not an eligible category of pay for contribution to TSP. So your lump sum leave cannot be part of the TSP. Can we still contribute to our TSP with retirement pay? The answer is no. Retired pay is not eligible for TSP contribution. For the Survivor Benefit Plan, or SBP, if I am unmarried yet have a dependent less than 18 years old, may I buy into the program? Yes. So you can buy into the program for your dependents. Once they reach 21, that will end the benefit unless they are full-time student. Even if they are full-time student, after 23 years, they cannot be your beneficiary. The only caveat to this is if the dependent is with a disabling condition, and that is when you have to work with the medical affairs branch to make sure that everything is on file. And if you have more, if you need to know more about the SBP, the retirement course on CCLMS provides a comprehensive update about the SBP. So I encourage you to start going into, log on to the CCLMS to review the retirement seminar. In addition, if you have the choice to be able to go to the tab, you can also sign up to the tab, which can be at a military base. But sometimes it's difficult to get on base to register for the tab. But if you are in the DC area and you are interested, I think Walter Reed have the option to be able to sign you up for the tab. So another question is, if I have 20 years of active duty service, but die before I retire, is my spouse eligible for the retirement and annuity? Yes, that is considered in the line of duty. So if you are on duty and you die before your 20 years, it's going to be an automatic, just like you retired. Every benefit that you get as a retiree is going to go to your beneficiaries once you die on active duty. And again, for more information about that, go to the death benefits and active duty death module in the retirement course on CCLMS.
Hey, Commander, I think we're almost at the 12:10 mark. I know you have a few more slides, and actually, in looking at these, they do address a lot of the questions that were coming up earlier in the chat box. So when we send this stuff out, I think the participants will be able to see, probably find the answers to a lot of their questions. But I want to thank you and Commander Dixon for your time today and for the presentation.
You're welcome.
I know we have.
Sorry about the technical difficulty.
That's okay. You can, if you want to stop screen sharing now, we'll get the next speaker in queue to present. Lisa Kelly is the Managed Care Support Liaison for Humana Military. This is a very important brief so that as you retire, you don't lose any kind of medical coverage, dental coverage, vision, all that falls under the TRICARE umbrella. She's been working in this field for over 10 years, and she is currently assigned to Fort Lee, which is here in Central Virginia. Lisa, are you ready to go?
Can you see my screen?
I can see your screen, Lisa.
Okay, great. Hello, my name is Lisa, she stated. And I work for TRICARE, and I'm going to present your TRICARE information about your retirement benefits, okay? All right, my screen is not, hold on, I'm sorry. It's not allowing me to advance, so. Okay, here we go. So today we're going to talk about preparing yourself for retirement, your options that you're going to have, and give you some benefit information. And then on the last couple of pages, it's going to be resources that for all the important phone numbers that you may need to assist you with preparing for travel. So this is one of the very first ones. This is important for you to have. This is where you reach out to Deers to make sure that everything is in order for your retirement and you have to get your ID card and you can sign up. You can go on the website and sign up for an appointment. You can log in to Meal Connect and change your information if you're going to be moving out of the area to whichever area you're going to be moving to. You can call and let us know, let Deers know, but sometimes that phone is you're on hold for a couple hours, and I don't know anybody who has a couple hours to sit and wait. Or you can fax. And this is you letting us know the changes that are made, where you're moving to, so we can provide care for you in that area. And in Deers, if you have a qualifying life event such as death, life, you get married or divorced, you move, you have a child, adopting a child, changing addresses, like if a college student's going to start school in August and out of state, out of your area, you need to change their information so we can provide them with the PCM in their area and or give them information about providers in their area. And if something else needs to change in the system or someone else needs to change, you can change. Once you have a qualifying life event, you can go in and change any of your programs, medical choices that you've made. So then if anybody has any Medicare eligible family members, they need to make sure that they're eligible for Medicare A and B before the sponsor's retirement date to avoid a break in coverage. Okay, you have to do it before your sponsor's retirement date so there is not a break of coverage. Okay, Medicare Part B will be effective a month after you enroll. Those who are under 65 who are eligible, you may qualify for TRICARE Prime. And then if you are, even though you're a retirement, you still consider that waiver, we waive that fee, that enrollment fee for the year. Okay. And here's a website for Social Security and Medicare, SSA.gov and Medicare.gov for more information. So anybody who is who's on retirement and they're going to go on terminal leave, your medical doesn't change until your retirement date. So you're still going to be considered TRICARE Prime as long as you are active duty up until that date that is written in stone that you're going to retire. You can't change your primary care. You can't move. You have to stay with the provider you have now. I always suggest that you get a physical and get your medications for 3 months. Let your provider know, hey, I'm leaving this area. I may need to reach back to you to get medicine refilled, or if something happens and you need to go to the urgent care or patient first, if you guys know if that's the thing in your area, or you go for urgent care information, you have to still get a referral. So you reach back to your PCM or you can call 1-800-TRICARE. That's the number to the nurse advice line, and they can enter a referral in the system for you so that you don't have to pay that bill. Okay. So again, active duty service members, you can't switch your primary care. If you move to a new area, you have to coordinate all your care with the current PCM that you have while you're in active orders. Now, that's not the same for your family members. If your family members are moving with you and you determine that this area we're going to live, once they get to that area, they can switch their PCM to whomever they choose, whichever is available in the system. Okay, as long as you've updated it first in DEERS. It has to be updated in DEERS first so that we can see the change. So who's eligible after retirement? The service member is eligible, the spouses are eligible, and some former spouses are available. Now, your children, as long as they're not married and they're under the age of 21 or under 23, if they're a full-time college student, they're eligible. Your parents-in-law, your mother-in-law, your father-in-law, or your mother or your father, they're not eligible for benefits unless they do TriPlus, which has currently been a closed program because it's been full. But unfortunately, if they're not eligible for benefits, for medical benefits. So TRICARE covers for retirees. You have to make an election. So when you retire, you update DEERS, you get your new ID card, or you get an appointment for your new ID card, and then you call TRICARE. You have to enroll in a program. You have to enroll in TRICARE Prime or TRICARE Select, okay? Or you can do TRICARE Overseas. You have to enroll into one of the 3 programs to let us know what you want. And the reason you have to make that first phone call is because you have to let us know how you want to pay. Are you going to pay out of your checking account, savings account, credit card? Are you going to have it deducted out of your retirement check, which most families do, because it's easier and they don't have to worry. The reason they do that as well is because there's a lot of fraud out there, right? There's a lot of people doing bad things to good people. And if you're one of those ones that your credit card is taken and it's the time that your payment is due, you'll lose and they can't withdraw your payment, you'll lose your medical. And you can't enroll back into the program until open enrollment, which is November, which then takes effect in the first of the year, which would be January. It's open from the 2nd week in November and it ends the 2nd week of December, but you're not eligible to use the program until January. So it's important that if you do put on a credit card, anything ever happens, please remember to make the change to fix it so that when it goes to TRICARE pulling their money, they'll get their funds. Okay. Now it says you can do it online by phone or mail, but the first one you actually literally have to call because they need to hear how you're going to pay, if you're going to have it come out that retirement check or what. So again, you're going to have enrollment fees that there will come out of the whatever decision you make, and then there's premium amounts and co-pays. And again, here's some websites, and they're going to be available as well. And I believe Annette says she's going to send the slides out for you guys, for you all. So if you choose TRICARE Prime, it works just like it does for you now. You see your primary care manager for all of your care. If you try to choose a civilian provider out in town, you can, if it's available in your area, if this space available for you to go to a civilian provider out in town, you could choose that provider. But always remember that TRICARE has first right of refusal, which means if you're outside, out to a civilian provider, and space available becomes within network at a military treatment facility or treatment clinic, you will be pulled back into that clinic for care. Some people like that, some people don't. But when you do have a prime PCM, it doesn't matter if it's civilian or it's military treatment facility, for all your care, you have to see them. And if you need a referral, you have to see your PCM first to get a specialty referral to take care of your needs. You would then, if under retiree, you would pay, I think it's about $38 to see that specialty provider. And you can get the care required for prime. You can go to the military treatment facility for medicines and all such. I'm gonna go more into that later. If you plan to travel or move, please, please, please get all your routine care before you leave. I've learned this during travels. My husband is prior military, that if you're going to do children's physical before you leave, it's kind of a little bit of a waste of time because each state has different guidelines and rules. So it's best you have to wait to get your child's physical. But what you would do, I would get all my child's medications for the next 3 months. I would get any paperwork and documentation to enroll them in school, any prior any issues they may have. I have it all documented so that when you transfer, you're not trying to reach back to your previous place of employment where you were, so that you can move on forward faster without having to worry. Now, if your family member is in emergency and they can go to the emergency room, they can go to urgent cares. They don't need to call nurse advice for a referral, only active duty service member. But once you retire, you then have that, if you have Prime, you're able to go to an urgent care, you're able to go to the emergency room without calling, okay? Now, the seasonal moves transfer enrollment to keep the cost low. What that means is if you have a split family where the children go in the summer to grandma's or your ex-spouse, transfer the enrollment over to them. That way it doesn't cost you guys those who have Prime, it doesn't cost any additional money because they're seeing a Prime provider in their area. So that's what that's referring to. Point of service. Point of service applies for if you have Prime and you want to go to the dermatologist, and this dermatologist is fired. Everybody raves about this dermatologist, but this dermatologist is non-network, not participating. You can still you can still go to that dermatologist. You're going to pay point of service, which is the deductible, which is $300. A portion of the deductible actually is what goes into it. And you're going to pay 50% of the rest of the bill. TRICARE is going to cover 50% of the allowable charge, which is a small portion. And the provider is going to bill you for the rest. Okay. You can then go to that doctor and then still be Prime, but you're just going to pay a lot more money for that provider. Okay. Now, when you're seeing that provider, you can always ask, hey, have you considered going TRICARE Prime? There's a lot of military families that would like to be a part of or to come and see you, but they can't because you're non-network, non-participating. And if they choose to say yes, that again helps you guys keep your costs low. Also, when you're in active orders, your catastrophic cap is $1,000 that you would pay out of pocket. The most that you would pay out of pocket for covered care. After you retire, I think it's like $3,000 for Prime. I forgot. There's a cost sheet also on the last sheet where you could pull up the tricare.mil/publications where you could pull up a cost sheet. Where you would pay, I'm sorry, what was that? The point of service charge. Pay that. Oh, the catastrophic cap. Sorry. So the catastrophic cap is the most that you would pay for your medical, for all covered charges. If you're in active orders, you hit that 1,000, rest of the calendar year. If you hit it in March, the rest of the calendar year is no deductibles, no more fees, and you're covered till the end of the year, and then it starts back again at the beginning of the next year. I hope I didn't make that complicated. You also have a choice of choosing the U.S. Family Health Plan. Now, I know it's showing that it's like in the light blue sections are the areas, but they've expanded. They're now in a lot more sections, but you'd have to go to tricare.mil/USFHP.com to find out more information. They work like Prime, but you have to go to the provider in that area. And only bad thing to me about it is you're not able to use military treatment facilities or clinics for any care. You can't use a pharmacy, ancillary, nothing. You only have to go to the providers that they state. And again, you have to enroll into this program I would say a week or two before your retirement. You do have a total of 90 days to make an election of what you want. But if you retire, let's say your retirement date was January 1st, and you have until like March, but you will show as direct care. And if you move out of the area and something happens, or you travel out of the area, you would show as direct care, which means you haven't made an election, which means you really don't have coverage. The only coverage you have is to be seen at a military treatment facility if space is available. So it's important that you make that call with TRICARE. You can make that a week prior. With US Family Health Plan, I'm not sure about their time that they would like for providers, or excuse me, for service members to call. But I would make that call, and I would make that soon as I can, because you don't want to be caught without insurance, because medical bills can be a booger. You have the option of TRICARE Select. This is another program. This is a managed care program. It's like a PPO, where you are responsible for your medical. You get to choose whichever provider you want. There's no referrals required. You do pay a deductible, and there's some cost shares that are set in stone. And there are prior authorizations, but that's for like big things like a surgery. They want to make sure that all the codes are set and you're getting, it's a covered medical event that you're having. So that's when the pre-authorization and would take place. And for overseas locations, it works just the same as Select. The good thing about it is, if you want to go to that dermatologist or that podiatrist or that ENT, you can. All you do is you call and make an appointment with that specialty or that doctor and book your appointment and go. If you need to see your PCM, you book an appointment with the PCM, and you just pay the fees associated with it. Okay? Good. I'm glad you guys are all hearing me. So if you use a network provider, you'll pay the fixed rate on the cost sheet. If you use remember the out-of-pocket or the if you use the out-of-pocket cost will be lower if you use a network provider. If you use a non-network, non-participating provider is one who does not accept our rates, and you would have to pay the full cost of the bill. So if you have a non-network, non-participating provider, that means basically TRICARE is going to pay a tiny portion. You're going to pay a deductible and the cost for this visit, and you will then pay the rest of the bill. TRICARE may pay a portion of it, a small portion of it, their portion, and then you're going to pay the rest. And that's going to be all on you. And if you don't pay it, it can go on your credit, which sucks. So the overseas program for Select runs just the same as the one here in the US. So you have the freedom to choose your provider. Referrals are required, enrollment is required, and services require pre-authorization. Again, those big surgeries or things that may be needed. And again, you use network providers, your costs stay low. If you use non-network, non-participating, your costs are much higher. You also have the opportunity to put your children in the TRICARE Young Adult program if they're at least 21 and not in college. But if they are 21, they go to the school administrator office and get a letter stating they're full-time college student and their anticipated graduation date. And if it's before their age 23, they will go ahead and push their TRICARE out the way you have it now. So if you have Prime or if they're on Select, whatever program you have, it will stay the same until they graduate. Once they graduate, you can either choose the TRICARE Young Adult program if they're unmarried, their employer doesn't offer insurance, and they can then qualify for the TRICARE Young Adult. And they have TRICARE Young Adult Prime and TRICARE Young Adult Select. About that program, you do have to pay 3 months in advance when you sign your child up for it, and they can hold on to it. It's a monthly fee. Again, it's on a cost sheet, and there's a monthly fee they can have. Now, if they're 21 and they're not a full-time college student and they're not doing anything, but working, then they can qualify for the TRICARE Young Adult Program. Okay? TRICARE for Life is a wraparound portion for TRICARE for those who are eligible. It doesn't mean you get TRICARE for the rest of your life. It is an actual program for those who are 65 and over. Once you turn 65, you're not allowed, they kind of push you out of the military treatment facilities, and you have to choose a provider out in town and that accepts Medicare A and B, and then you would have TRICARE for Life as part of your plan. It's at no cost. There's no enrollment fees, and there's no forms or anything that need to be filled out. You make sure you have your new ID stating that you're 65, or if your spouse is turning 65, they could, this is also available for them, that they can just get their ID to make sure they turn 65. And how it works is Medicare A and B pays first, and let's say there's a copay of $50, and then they bill that copay, Medicare does, to TRICARE for Life, and then TRICARE for Life pays that $50, where then the family or the dependent does, or you will pay nothing because it's all covered. Most covered things that are covered through Medicare are also covered through TRICARE for Life, but some things aren't. But again, you would have to go to tricare.mil/TFL for more information. Or you can call TRICARE for Life at 866-773-0404. For the TRICARE overseas, using TRICARE for Life, it works just like Select. There's no difference in that. Everything works the same, and you have to, they have a TRICARE area provider that can help you with filing claims, but you have to reach out to them. So the military pharmacy is, if you have TRICARE Prime or Select and you retire, you can have your scripts, only young adult can't. You can have your scripts mailed or electronically submitted. I'm sorry, not mailed, but electronically submitted to the military treatment facility, and they will give you a 90-day supply. You then will go and pick it up. If you live near one, that's a great benefit. It saves you money. Or you can have the home delivery, which is Express Scripts. It's used for most drugs. They have it delivered directly to your home. You get a 90-day supply, and you pay the copay for if it's formulary or non-formulary medication. You just pay the cost of that, and it's directly delivered to your home, and they have more information. Or you can use a retail pharmacy, such as in this area, it's like Walgreens. You go to Walgreens, you'll get a 30-day script, and you may pay the formulary and non-formulary price. It could be anywhere from $3 to $36. And now, you don't ever want to use a non-network, non-participating, because you're going to pay the full price up front. You have to file your own claim to get a small portion, to get a portion of your money back. And you only get a 30-day supply. So that medication has been known to be up to thousands of dollars, and you will pay those $2,000 and then get your receipt, go to the website, get a claim form to fill out. It's a lot of work. It's always best to say, you can go to expressscripts.com and look up Find Care or find a provider that's near you instead of using a non-network. I never suggest anyone use a non-network provider. Now, other health insurance, some of you may retire and you may choose to use your employer's insurance. You can have your new employer's insurance, and you can have TRICARE, but your new employer's insurance would pay first, TRICARE would pay second. Now, if you get an awesome job and their benefits are great, good. You don't even have to choose TRICARE, but whenever you do decide to use it, or you decide to quit, or decide to retire to a second job, you can always fall back in TRICARE. TRICARE is a benefit that you've earned for doing your 20 years of service. And so it's always there and available for you. Excuse me, but remember, you have to all the other insurances that you choose, or if you decide to go on your spouse's insurance, that insurance pays first. and if you have TRICARE, TRICARE pays second, okay? Again, it's always primary insurance. They're gonna always pay first. They're gonna pay before TRICARE does. And most companies submit the claims, once the claim's been processed, they submit it to TRICARE. They said you still can use military pharmacies, but again, if there's a copay or something deductible, it has to go through your other insurance, then it comes through TRICARE. Now, if you get a job with the federal program or federal government, you can't choose this program. But if you don't, because it's already going to be an option for you guys. So that you can't choose two of the same exact programs. So the U.S. Office of Personnel Management offers the TRICARE beneficiaries the opportunity to enroll in the FedVid program. It's dental and vision. Because the day you retire, you lose your dental. And you have an option to choose a plan that works best for you. They have several providers, and United Concordia is one of them if you like staying with your provider. And they offer a range of appointments. It's a high, medium, and low cost. And you retiree and their family members are eligible. Guard and reserve, their family members are eligible, and certain survivors. Excuse me, I'm sorry. So former spouses and remaining surviving spouses don't qualify to purchase the dental program. But the Vision program is a program that's available for TRICARE Prime and Select or Reserve Select or retirees, or if you have TRICARE for life. Again, it's just like the dental, FedVid Dental, where you have to choose a high, medium, and low program. They vary in ranges. It's a premium-based program, both dental and vision, and you choose a provider that you want that is networked to keep your costs low. And the Vision Care is going to be available to active duty family members, retirees, and National Guard and Reserve. Now, you don't have to choose this if you have Select, because it's going to work. If you have Select, you're going to pay a little bit of money for your eye exam, or you could pay for this. You really want to look and see if the Vision program works for your family. It's not, you don't have to choose it. Or you can choose it and see if it benefits your family, and then you can also then let it go at the end of the year, the dental or the vision. But remember, dental cancels out the day of your retirement. If you're in the process of getting, if one of your dependents in the process of getting braces, what they end up doing is they'll cut it off and prorate the amount and it goes back to you as a bill as to how much you would pay. That's a question that I get often. And we meet the requirements of the Affordable Care Act. That's all we're supposed to say on that. And here's the last slide. This is for the East region, the West region, this overseas region, TRICARE.mil, and you / whatever you're looking for, and it will come up. And you can go to publications to find the cost sheet, and you can go to MilConnect to update your information.